Well, it is a very big demanding field, and there's a lot of demand for these workers. It's the nursing career, and joining us today, the Director of Nursing at Bluffton University, Dr. Sherri Winegardner, and to tell us about their program. So thanks for joining us today.
Thank you so much for having me, Holly.
Okay, so first of all, you've got big news about your program, about accreditation. Tell us about that.
Absolutely big news. The university nursing program is already accredited through the Higher Learning Commission and through the Ohio Department of Higher Ed. We've just completed a year-long process of getting our national accreditation through the Commission on Collegiate Nursing Education. As I said, it was a year-long process, and we successfully passed all 4 standards and now are not only accredited through Higher Learning Commission at the state level, but now at the national level as well. So big news for our program.
And I assume that is like big news to help boost students, and employers look at that too. It's like a win-win for both sides.
It is a win-win for both sides. Employers definitely look at students who have graduated from nationally accredited programs. In addition, for nursing students who are graduating with their baccalaureate degree, most of them hopefully are going on to graduate study. And in order to complete graduate studies, such as going in to be a nurse practitioner or a nurse anesthetist, they have to have graduated from school that's nationally accredited.
Wow, all right, that's exciting stuff. So we hear all the time about, especially the pandemic, the medical field is so important, and there's a shortage, especially with nurses, I still believe. So are your students coming out and finding jobs right away?
Yes, as a matter of fact, the majority of our students, because of the nature of our program as a collaborative with Rhodes State University, our students actually are able to complete their NCLEX exam and become RNs at the end of their 3rd year of study. So all of our students were employed pretty much at the at the end of their 3rd year. But as they graduated, all of them were employed immediately in various settings. I have students employed at various locations, including Lima Memorial, St. Rita's, Blanchard Valley, and Toledo Hospital.
So that seems like a unique structure. Is that different from other programs where they can get things done and then kind of their final year be a registered nurse and working?
Our program is a little unique in the structure. There are similar programs to ours that are referred to as 1-to-1 programs, where students attend the 4-year university their 1st year and then go into their collaborative program exclusively for 2 years and then come back to the university setting for 4 years. Ours, however, being the type of hybrid it is very unique in that our students, all 4 years, are attending the university as well as their collaborative program in years 2 and 3, which is what permits them then to be able to sit for that NCLEX. And as I said, it's unique that our students are able to graduate from the collaborative program at the end of year 3, take their boards, become RNs, and start working a little bit, and then complete the advanced coursework for their BSN in year 4.
Are you getting good at, I assume, feedback from the students about how the program works and how successful they've been?
Yes, they really, really appreciate, as you know, most students going to college have student debt. So for those students, they're very appreciative that at the end of that 3rd year, they can actually get out into the work world. And as you know, wages for registered nurses are pretty significant, and those students appreciate the ability to work and start putting back some money toward their education.
I mean, you've been in this career field. Things have changed a lot. So what kind of personalities do you see going into the future that are good for nursing?
People need to be very outgoing. They need to be people. Nurses work in a variety of settings. Traditionally we think of nurses working in hospitals, but nurses are involved in all kinds of community settings now, whether it be public health has been a big field for nurses with the onset of the pandemic. So they need to be outgoing, need to be people. And one of the things is people who are going into nursing need to be committed to lifelong learning. It is definitely a career that keeps you on your toes, and you're always growing professionally.
Wow, some great stuff. A really neat program to learn more about at Bluffton University. Thank you for joining us today.
Thank you so much, Holly.
All right, don't go away. Noon Edition continues in a moment.